The PrEP Act, just for context to help kind of set the frame, actually stands for Public Readiness and Emergency Preparedness Act. And so already kind of setting the tone, this is something where it's an emergency is taking place. It's out of the ordinary. We're going to see that's kind of weave throughout. So one of the themes I want everyone to keep in mind when thinking about the PrEP Act is it's very narrow, the gate to get in and when it applies. But once you're in, the protection is pretty wide. It covers a whole host of things. It's about getting in. And it's immunity for claims based on certain activities associated with covered countermeasures after the HH Secretary issues a declaration under the PrEP Act. So one of the key things focused is all of this ties back to covered countermeasures. Another kind of foundational thing I want people to keep in mind is, although the statute's 15 years old, there's only one meaningful case involving the PrEP Act, and it goes back to the N1H1 outbreak when a nurse by a county inadvertently gave a vaccine to a kindergartner without the parents' informed consent. And they brought a suit against the county, which the state court dismissed, saying PrEP Act provided immunity for it. So there's a lot of questions that we can start to think maybe coming about how does this apply, particularly now with COVID-19 and very massive use of FDA's emergency use authorization in these kind of experimental treatments. Yeah, there's going to be a lot of great questions. We don't have much guidance from how the court would interpret the statute, so we're left with the statute and its intent as we think through it. So one of the things talked about is it's a narrow opening, and it only applies to covered countermeasures, which is a precisely defined term. And there are 3 original categories, and a 4th one was just added. It's qualified pandemic or epidemic products, defined term. Security countermeasures, also defined term. Or a drug, biologic, or medical product that has an FDA emergency use authorization. And I want to pause there for a moment because we're hearing a lot about emergency use authorization in the news with FDA and a lot of different things. What an emergency use authorization is basically FDA is in the middle of a crisis, and the usual process of approving medical products on safety and efficacy is just going to take too long. We might not have enough data. And so there is a public policy judgment call saying doing something is better than nothing. And so the standard is it may be effective. And so one of the things right now is the chloroquine, for those who enjoyed MASH. I did. That drug may sound familiar. It was in MASH, and it's for malaria treatment, but it may be effective in combating COVID-19. And so FDA has recently granted an emergency use authorization. That's one of those categories to get in for it. And then the 4th one, which was just added, was for NIOSH-approved masks. And once the Secretary determines a priority is needed for them during a public health emergency. Those are your 4 buckets, the covered countermeasure. With the exception of the NIOSH mask, the product has to be a drug, biologic, or medical device. That's written into the definition for qualified pandemic or epidemic product and security countermeasure. So right off the bat, if you are not an FDA-regulated medical product, aside with the masks, this is not a protection that you can enjoy or even contemplate. Another part of it isn't just the statute. The HH Secretary has to issue a PrEP Act declaration, which is different than a public health emergency declaration. And in that declaration, the Secretary gets to specify who exactly is the covered party. So there's the statute concept and then what is applied to a specific situation.